Hi all, welcome to OET Speaking. Today we can discuss an OET role play. Here the setting is a community health center. You are talking to a 50-year-old man who was referred by his employer to see you about his health concerns. He is overweight and his BP is 150/90. Task: ask about his health concerns. Inquire about his lifestyle, diet, exercise, drinking or smoking habit. Check when he last visited his general practitioner. Advise him that his blood pressure indicates hypertension and should be checked regularly. Stress the importance of regular checkup. Give him suggestions regarding weight loss, that is, less fat, less salt and reducing alcohol intake along with 30 minutes exercise 4 to 5 times a week. Here the setting is a community health center and the patient is referred by his employer. So we have the referral letter is with. So we can start our conversation by saying, "Good morning, my name is Sarah. I'm a registered nurse in this community health center." Then you can ask, "How may I address you?" Let's assume the name is Mr. John. Then you can ask question like, "What brings you here today?" Or you can ask, "I have some notes with me, but it would be better if you could tell me what brings you here today." Then, probably as per the interlocutor's card, he may tell you like, "Sister, I just came here for blood pressure check because I concerned about health. And my father died because of stroke, so I'm really concerned about my blood pressure. And I feel I might get stroke. So could you please check my blood pressure?" Then we need to tell him like, "Definitely Mr. John, I will check your blood pressure." Then you can tell him like, "Mr. John, I can see that you are really concerned because your father died because of stroke at an early age. Anyway, you came here for blood pressure check. So I really appreciate your decision." And as per our second task, we need to inquire about lifestyle. So we can ask questions regarding diet, exercise, drinking or smoking habits. Before asking any question, we need to ask permission from the patient. So you can ask permission by saying, "Mr. John, before proceeding further, I would like to know about your lifestyle." Or you can ask, "If you don't mind, may I ask you some questions regarding your lifestyle?" Probably the patient may agree with you. Then we need to inquire about diet, exercise, habits. So you can ask some questions like, "Could you tell me about your diet pattern?" "Could you tell me about your diet pattern? How about your exercise? Do you have any habit of smoking or drinking?" These 3 questions you can ask one by one. Then the patient will reply according to the interlocutor's card. Probably the patient may tell you like, he prefers junk foods and drink occasionally. Then as per our third task, we need to inquire about his last visit. So we can ask question like, "Could you tell me when did you visit your general practitioner last?" "Could you tell me when did you visit your general practitioner last?" Probably the interlocutor might say you like, "Sister, it's long back." After all these questions, we need to give him thank you. So we can tell him like, "Okay, Mr. John, thank you for answering to me. It helped me to understand your situation much better." Then as per our fourth task, we need to advise him that your blood pressure indicate hypertension, that is, blood pressure is on higher side, and stress the importance of regular checkup. So we can ask him like, "Mr. John, let me just check your blood pressure now." Only the patient may agree with you. Then after 2 seconds, you can tell him like, "Mr. John, I have checked your blood pressure. I can see that you are having a borderline hypertension. That is, your blood pressure is around 150/90 range. So I think it's very important that you come and check your blood pressure regularly. I highly recommend that. If you could come, that would be really beneficial for you." Is that clear? Are you okay with my suggestion? After checking the patient's blood pressure, you can tell him like, okay, Mr. John, I have checked your blood pressure. I can see that you are having a borderline hypertension. That is, your blood pressure is around 150/90 range. So I think it's very important that you come and check your blood pressure regularly. If you come, that would be really beneficial for you. Is that clear? Probably, as per the interlocutor's card, he may agree with you. He may tell you like, sister, I will come and check regularly. If the patient is not agree with you, in that situation you can tell him like, Mr. John, I would like to tell you regarding the importance of visiting your general practitioner once a month or at least once a year for a complete follow-up checkup. If you do a follow-up checkup, we can treat your condition as early as possible. Also, we need to avoid future complications also. Am I clear to you? And as per our last task, we need to give him some suggestions regarding diet, exercise and alcohol habit. The patient is really concerned. So sometimes he may ask you questions like, sister, will I get stroke? Then we need to reassure the patient. So we can tell him like, Mr. John, it's understandable to feel worried in this situation. There is nothing to be alarmed about your condition. You are safe in our hearts. And I would like to tell you that you won't get any stroke if you follow our instructions. So I recommend you to modify your lifestyle. Will you be doing that? As per our last task, we need to give some modification. We need to give some advice to modify his lifestyle. First, we need to give advice regarding diet. So we can tell the patient like, Mr. John, when I checked your blood pressure, I noticed that the proportion of your body weight is little bit on the higher side compared to your height. So, in order to reduce your weight, you need to have a healthy diet pattern. You can have foods which contains less fat and less salt. This less salt and less fat food makes you more healthy and your BP also will reduce. Am I clear to you? So, regarding the weight, you can tell him like, Mr. John, when I checked your blood pressure, I noticed that your proportion of your body weight is little bit on the higher side compared to your height. So, in order to reduce your weight, you need to do some modification like you can have food which contains less fat, less salt, because these foods makes you more healthy and you can reduce your blood pressure also. Are you following me? Then, regarding the alcohol intake, you can give him suggestions like, Mr. John, it would be better if you could reduce your alcohol intake. Will you be doing that? Regarding the exercise, you can tell him like, Mr. John, please try to spend 30 minutes time for physical activities. You can do some physical activities at least for 30 minutes 4 to 5 times weekly. Are you okay with my suggestion? You can ask. Probably patient may agree with your suggestion. Then we can tell him like, I am glad to hear that you are going to accommodate all my suggestion. You can wind up by saying, do you have anything to share with me? If there is nothing, you can tell him, thank you Mr. John. I hope I have cleared all your concerns and you will follow all my recommendations that I hope you will follow all my recommendations that I have given to you and try to visit your general practitioner at least once a month. Thank you Mr. John. Get well soon. If you need any help, you can call me at any time. I will be here to help you. In this way, you can end up your role play. Thank you.